need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner. So that's what I was saying previously about the transition from movement restrictions and shutdowns and stay-at-home orders can only be made if we have in place the means to be able to detect suspect cases, isolate suspect confirmed cases, track contacts, and follow up on the contact's health at all times, and then isolate any of those people who become sick themselves.
They have a post. In Italy, only 12% of COVID-19 deaths list COVID-19 as cause. Report shows up to 88% of Italy's alleged COVID-19 deaths could be misattributed. And they talk about the report, citing Professor Walter Ricciardi, in which he says, the way in which we code deaths in our country is very generous, in the sense that all the people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. On reevaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity, i.e. Other type of disease. Many had 2 or 3. The president of the Italian Civil Protection Service actually went out of his way to remind people on the nature of Italy's fatality figures in a morning briefing on March 20th. I want you to remember these people died with the coronavirus and not from the coronavirus. The coronavirus and not from the coronavirus. What does this actually mean? It means that the Italian death toll figures could have been artificially inflated by up to 88%. If true, this would mean the total number of Italians who have actually died of COVID-19 could be as low as 700, which would bring Italy, currently a statistical outlier in terms of COVID-19 fatalities, well in line with the rest of the world. It means thousands of deaths currently widely attributed to COVID-19 and being used to justify the introduction of measures equating to medical martial law may not have died of COVID-19 at all, but of their serious chronic comorbidity, cancer, heart disease, etc.
So it appears